So students, in this lecture, we are going to discuss standard anatomical terms. So before going into the detail or the definition of this term, you must assume a subject. So the terms which are described in this lecture are according to the subject. That is, they are subject oriented. If I'm saying the right side, it means I'm saying the right side of that subject. I'm not discussing about my right side. So now, what is the anterior position? Another name of anterior position is the ventral position. It refers to the front. Now, what is posterior? This is posterior, or the back or the dorsal position. That is the back side of the subject. Now, what is superior? That is closer to the head. Inferior, that is closer to the feet. For example, the neck. The neck is inferior to the head. Now, midline, this midline is actually the imaginary line that is dividing your body into two symmetrical halves, that is the left and the right. Then medial, this medial is actually referring the location that is closer to this midline. Lateral, that is away from the or from the midline. Then deep or the superficial, these are representing the depth within the body. Deep means internal, that is away from the surface of the body. Now superficial, that is external, that is close to the surface of the body. The muscles in your body is deep to the skin. So difference between distal and the proximal. So these are the locations of the structure in relation to one another. So distal, that is away from the reference point. Proximal, that is close to the reference point. For example, here you can say that the ankle is distal from the knee. Then visceral, it is related to the internal organ. When I will discuss the visceral organs, it means I'm talking about the internal organs. Parietal, that is related to the body wall, body cavity, or the hollow structure. So students, this was all about the anatomical structures.